I'm Professor Semra Kahraman. I am the director of Istanbul Memorial Hospital, Assisted Reproductive Technologies and Reproductive Genetics Center. Our unit is the largest ART unit in Turkey with more than 6,000 cycles a year. It's a huge number from a single center. And our group pioneered microinjection, embryo freezing, and pre-implantation genetic testing in Turkey for the first time. And because of our expertise and experience, a large number of patients come to us for particularly severe male infertility treatment or pre-implantation genetic testing. And we are the only center which has its own reproductive genetics laboratory. And in the last few years, we have also been working on reproductive genetics. Well, which into the genes, sometimes which may possibly involve in severe male and female infertility. And our center is officially certified by the Turkish Ministry of Health as a training center and has educated a large number of doctors, embryologists, and biologists in the field of IVF. There is no formal referral system in Turkey. Patients find a fertility doctor or center in a variety of ways. And these include recommendations from friends, from family members, or casual acquaintances who have had the successful treatment. And also the internet search, as in your country, particularly in women's forums, patients give great importance to comments made by other forum members on centers, individual doctors, and so on. So internet search is another way of finding a fertility doctor in Turkey. Patients also go onto fertility center websites. For example, our center website has detailed information on male and female infertility, on advanced ART technologies. It has a frequently asked questions section, and they have the information from here about the details of controlled ovarian stimulation, medications, IVF-related procedures, and reproductive genetics. And another source is informal recommendation from doctors, from, for example, not the gynecologist, not from the IVF specialist, but from other doctors who are aware of a center's reputation and success. These are the systems that the patient use usually to find a fertility doctor in Turkey. Unfortunately, we don't have a legal referral system in our country. In Turkey, fertility treatment is available under the national social insurance system at low cost. However, it's available only at in-state or university hospitals or in some private IVF centers who have a specific agreement under the social insurance system. There is no funding within other private IVF centers, and the cost of the treatment has to be paid by the patients, which is unfortunate for many of the patients. However, the cost of testing and IVF treatment in Turkey is very low compared to the cost in the USA. I know that in USA, it is expensive compared to prices in Turkey. For example, one cycle of basic IVF treatment is about $1,500 USA in Turkey, or at most $2,000 in Turkey. But as far as I know, it is more than $15,000 in the United States, which is a huge difference. So relatively, our patients are getting benefit from these treatments in Turkey in a low price. Of course, if further more complex tests and procedures are required, the costs are higher because we need some extra tests, some genetic tests, other investigations. For example, if a couple need pre-implantation genetic testing for chromosomal evaluation of the embryos, they need to pay an extra $300 for each embryo. This kind of extra payment can be paid by the patients. And most couples in Turkey use these private centers because of their superior facilities and their high success rates. Rather than going to the state hospital or university hospital, they prefer to come to the private IVF centers because in the state hospitals, the facilities are limited and the success rate is relatively lower compared to the private IVF center in Turkey. In fact, more than 80% of all IVF cycles in Turkey are performed in private centers. In Turkey, as most infertile couples pay the cost of treatments themselves, so they are usually unwilling to pay the first-line treatments like Clomid, for example, or intrauterine insemination, because they have a relatively lower success rates. Because we know that compared to IVF, intrauterine insemination just provides a lower success rate. Even if they make one attempt, the couple just try one attempt, if it fails, they choose to go direct to IVF treatment rather than spending more time and money on the first-line treatments. And of course, IVF treatments give them the chance to have some embryos frozen for future attempts if they need them. So these are the reasons that most young patients would like IVF as a first-line treatment in Turkey. And another trend is for centers to use intracytoplasmic sperm injection rather than in vitro fertilization for all couples. And this is to avoid the disappointment of low or no fertilization, which can occur in 10 to 15% of IVF cases. And again, as a doctor, it's difficult to explain them that you paid the money, but with ICSI, without ICSI, with IVF procedure, your success rate, your fertilization rate is about 30%. So now you have a lower chance. So we have to go for another IVF attempt if this fails. This is the reason that, again, the financial reasons are the main point in here. In Turkey, there is a trend to use ICSI as a regular IVF procedure. And also, legislation in Turkey allows double embryo transfer in the majority of the patients. Well, we have the legislation which was published in 2010, and according to this legislation, for the patients above 35 years old, up to maximum 2 embryos can be transferred. For younger patients, younger than 35, for the first 2 treatments, a single embryo transfer is allowed, but then they can have double embryo transfer. So, of course, most patients, even young patients in this situation, choose double embryo transfer in Turkey. And most centers also perform double transfer in the hope of having a higher chance of pregnancy. However, in our center, we perform single embryo transfer only, except in rare cases, for example, advanced maternal age cases or cases with bad quality embryo development in repeated cycles. But because according to our results, pregnancy rates are just as high and we avoid the risk of multiple pregnancy when we transfer single embryo. Also, there is a growing trend in Turkey using pre-implantation genetic testing now. It wasn't like this previously, but nowadays there is a trend like this. It is not only for advanced maternal age patients, but also for young patients in order to shorten the time to achieve a healthy live birth. So if we summarize, the trends in Turkey is just they tend to go to the mostly private IVF centers, and ICSI is used as a standard IVF procedure, and legislation allows in most of the patients for double embryo transfer, and there's a growing trend for applying pre-implantation genetic testing in Turkey. In Turkey, there is a high rate of consanguineous marriages. In some specific areas, it's as high as 70%. It's a great number. Of course, this increases the occurrence of the transmission of genetic disorders. So this is one of our biggest problems in Turkey. So pre-implantation genetic testing for genetic disorders is available in some centers in Turkey, including our center. As I mentioned before, we were the first in Turkey presenting this technique for the first time in 1997 to Turkey for monogenic disorders. And then, of course, we use it for chromosomal disorders. And we have patients from both Turkey and from other countries who come to us for pre-implantation genetic testing, not only for monogenic disorders, genetic disorders, but also for chromosomal disorders. And in addition, PGT for genetic disorders with HLA typing is available in Turkey. What is HLA typing? This is for families, as you know, with a sick child suffering from a life-threatening genetic condition. PGT in combination with HLA typing is used in these couples, and not only to avoid the birth of affected children, but also to conceive healthy children who may be also a potential HLA identical donor for its sick sibling. And then stem cell and bone marrow transplantation can be planned in order to restore full health of the sick child. I think this is very specific for Turkey. And what makes it very specific, the consanguineous marriages in Turkey. In our center or in Turkey, as most of the other centers, we prefer to use short antagonist protocols with or without estrogen priming. You know that short protocols are more patient-friendly. It takes less time compared to the long protocols. The cost is lower, again, compared to the long protocols. But let me explain how we decide on whether to use estrogen priming, because it is important. When you use short protocol, I believe that estrogen priming is important. Well, if a patient has the history of significant asynchronized follicular development, of course, this affects the success rate of cycle outcomes. Why? Because of the low mature oocyte yield. Because if you have some follicles that they are growing fast, some are coming later, some small follicles, then it affects the number of the mature oocytes that you retrieved from the patients. And then it affects the number of the frozen embryos, the number of the good quality embryos, so on. So we start estrogen priming. It is a simple estrogen patch that the patients just put on their body in the patient's previous cycle, 8 to 9 days after the detection of ovulation. And the aim is to suppress the FSH and LH hormones to prevent very fast follicular development. When we use it in the late luteal phase, which means that it is a couple of days ago from the expected menstrual cycle. And they change the patches the day after, and then usually after 2 patches, then they have the bleeding and we start with the treatment. And with this way, we see that most of them are having a synchronized follicular development by using this estrogen priming. And we rarely use long protocols in our center, as there is no significant difference between the long and short protocols in terms of clinical outcomes. However, we do use long protocol in cases if short protocols repeatedly fail, and in cases with severe endometriosis. And the other medications, protocols that we use very commonly in our center and in Turkey, of course, is the endometrial preparation protocols for the frozen toad embryo transfer cycles. Well, the vast majority of our cycles in our clinic, more than 85%, are frozen toad embryo transfer cycle, because we use PGT in a very high number of patients, And then there are hyper-responder patients that they need to have their embryos to be frozen. And wherever possible for these patients, we use natural cycle for endometrial preparation rather than using artificial cycles. Because the alternative is the artificial cycle, which needs a long-term use of estrogen pills. So the clinical outcome between the artificial and natural cycle is not significantly different. But natural cycle is a more patient-friendly approach, we know that. And because of there is no long term of exposure to estrogen, we prefer to use the natural cycle wherever it is possible. And also in our center, we do not use treatments that are not yet proven to be effective. That is important. For example, if I just give an example, the platelet-rich plasma injection, PRP treatment, it is claimed that in many centers or by many doctors, PRP increases ovarian response to hormones in poor responder cases, or it makes the endometrium thicker in cases where the endometrium is very thin. But this has not yet been proven so far. However, despite this, in Turkey at least, it is used widely in some centers, but we do not prefer to use this kind of treatments that are not yet proven to be effective for our patients. Patients come to Turkey for treatment from all over the world, actually. In our center, we have had patients from 59 different countries, mainly neighboring countries such as Bulgaria, Romania, Albania, the Middle East, and former Soviet bloc countries, but also from as far as away as the States, Australia, and Africa, but of course, mostly from the neighboring countries. And why do people come to Turkey? Well, there are two main reasons for that. Firstly, Turkey has a good reputation in the application of IVF in the neighboring countries, and of course, the availability of advanced techniques in most of the private centers. But the other reason, and the most important reason, is the financial reason. As I have mentioned before, in Turkey, you can have this treatment in a relatively low cost and with an acceptable pregnancy rate. And also the advanced techniques are used in many centers in Turkey. For example, in our clinic, the majority of foreign patients come to us for pre-implantation genetic testing. It is an advanced technique, you know. Others come, for example, for surgical sperm recovery techniques, such as microTese or TESA procedure. Others come for hysteroscopic and laparoscopic surgeries. Also, couples come to us to benefit from new technologies, such as, for example, next generation sequencing that we have been using since 2017, advanced sperm selection techniques, continuous embryo monitoring systems, time-lapse imaging systems, in order to follow the embryo development in cases where repeatedly poor embryo development occurs. So these are mainly the reasons that mostly the neighboring countries are coming in here. And in fact, in our center, 1 in 4 patient is coming from outside of Turkey. So we have a lot of translators in our unit for each country. Well, of course, they are going out because of the prohibited procedures. In Turkey, the use of donor sperm, donor oocytes, donor embryos, a gestational carrier, surrogacy, and gender selection are all strictly prohibited by laws. So these are the main reasons that the people leave our country for treatment. So they can't have this service in Turkish IVF centers at all. According to Turkish regulations, fertility treatment cannot be given to unmarried couples. That is the most important point. Unmarried couples, in another saying, cannot have IVF treatments. Even patients coming from, let's say, Bulgaria, for example, they have to get married if they would like to get the service in Turkey. That is obligatory things. In addition, the use of sperm, donor oocytes, donor embryos, surrogacy are all strictly prohibited, as I just emphasized before. Also, fertility treatment for single mother is not permitted, which you call it single mom, is not permitted in Turkey. And doctors are prohibited from advising or assisting patients to receive these treatments in countries where these treatments are legally available. So, for example, if a patient asks our opinion, doctor, I couldn't get any success from the treatment here. I would like to go outside of Turkey for sperm donation, for egg donation. Where do you just recommend to me to go? We can't even advise any place, or we can't give detailed information about these procedures, because the penalties for doctors, for all medical staff and centers in breaking regulations are very severe in Turkey. The doctors are heavily penalized if they are in breach of these regulations. Centers can be permanently closed, and doctors can be banned for life. So when you just have all these regulations and legislations and laws in Turkey, then you can't really talk about it. One reason why we have these regulations in Turkey that is given for these prohibitions is that children have the right to know who their biological parents are, and also to preserve the genetic inheritance of the baby. This is at least what we have just informed from the Turkish Ministry of Health. And when we just discuss about all these procedures, these are the reasons that they just share with us. And homosexuality is not illegal in Turkey, by the way. However, people who identify as LGBTQ are at a disadvantage in terms of basic rights and freedoms such as gay marriage, same-sex marriage, child adoption, and gamete donation or donor procedures. Although LGBTQ are protected by laws against discrimination and violence, there is not even any discussion regarding their marriage or reproductive rights. Since gay marriage is not recognized, they do not have the legal right to marry, and discussion of reproductive rights is not yet relevant in Turkey. The favorite part for me is to see the patient's happiness, of course, and to deal with the most difficult patients. If I get a positive results from a very difficult couple, then it is my happiness, my biggest happiness. If, for example, you just ask a question to me, if you could fix one thing about fertility treatment in your country, what would it be? This is one of other important point for me, because I would like fertility treatment, whether it is in state hospitals or private centers, to be state funded in Turkey. That would be my biggest happiness. If I see that it will realize in Turkey, I would be very happy. In Turkey, the majority of couples pay for their treatments, and it is very difficult for the couple who have not in a good position in just paying the cost of the IVF. Couples who go to the state hospitals unfortunately have a lower success rate because of the limited facilities, and so the majority of couples either right away or eventually come to private centers because of the superior facilities. And for many couples, it is a struggle to afford repeated treatments, and they either give up entirely or lose valuable time trying to save up money for another treatment, reducing their chance of success. This is especially problematic for poor ovarian reserve patients or advanced maternal age patients. And a second chance, if I would make, would be to strictly limit the use of double embryo transfer to advanced maternal age patients only. Even in these patients, in these maternal age patients, we should encourage the use of single embryo transfer in combination with pre-implantation genetic diagnosis in order to select the best embryo with the high implantation potential. So these things, would make me very happy if I see one day that they will be realized in Turkey.